are going to talk about the etiology of the West Nile virus. The scientific name for this virus is the Flaviviridae flavivirus, which is the family of the genus. This is a viral disease, and its envelope. This envelope is a layer of phospholipids and proteins that form a coating over the virus. This may help the virus to survive to infect other cells. The viral genome of West Nile is a single strand of a positive RNA gene. And this can be spread by infecting mosquitoes, and mosquitoes become infected from infected birds. It can also be spread through organ transplants and through blood transfusions.
Gutenberg Lucena here. I'm going to be talking about the primary reservoir of the West Nile virus. West Nile virus is maintained in nature in a mosquito-bird-mosquito transmission cycle. West Nile virus is indigenous to Africa, Asia, Europe, and Australia, and it keeps being reintroduced to several areas of the world due to bird migration and mosquito proliferation. Humans can become a potential agent in transmitting the West Nile virus in cases of blood transfusion and organ transplants. West Nile virus has been detected in dead or dying birds of more than 250 species. Birds can be infected by a variety of routes other than mosquito bites, and different species may have different potential for maintaining the transmission cycle.
Hi everybody, my name is Stephanie Sproul, and for my part of the presentation I am going to discuss the signs and symptoms of the West Nile virus, along with how the virus is transmitted from one host to another. What are the signs and symptoms of the West Nile virus? For clarification, the difference between a sign and a symptom is this. A sign is something that is visibly seen by the doctor or the patient, and a symptom is something that is felt or is being experienced by the patient. Now, most people, about 70 to 80% who become infected with the West Nile virus, do not develop any symptoms or signs. About 1 in 5 people who are infected will develop a fever with other symptoms such as headache, body aches, joint pains, vomiting, or diarrhea. A skin rash or large mosquito bite is the most common sign of the West Nile virus. And on this slide, I have included a couple of pictures of what the bite or rash may look like. And most people with this type of West Nile virus disease recover completely, but fatigue and weakness can last for weeks or months. Less than 1% of people who are infected will develop a serious neurologic illness, such as encephalitis or meningitis, which is the inflammation of the brain or surrounding tissues. The symptoms of neurologic illness can include the headache, high fever, neck stiffness, disorientation, coma, tremors, seizures, or even paralysis. Serious illness can occur in people of any age. However, people over 60 years of age are at the greatest risk for severe disease. People with certain medical conditions such as cancer, diabetes, hypertension, kidney disease, and people who have received organ transplants are also at greater risk for serious illness. Most of this information that I got, I have listed the source that came from the CDC website. Next, I'd like to talk about how the West Nile virus is transmitted from host to host. Human infection is most often the result of bites from infected mosquitoes. Mosquitoes become infected when they feed on infected birds, which circulate the virus in their blood for a few days. The virus eventually gets into the mosquitoes' salivary glands. During later blood meals, when the mosquitoes bite, the virus may be injected into humans and animals where it can multiply and possibly cause illness. The virus may also be transmitted through contact with other infected animals, their blood or other tissues. There is a very small proportion of human infections have occurred through organ transplant, blood transfusion, and breast milk. There was only one reported case of a transplacental mother-to-child West Nile virus transmission. If you look at the picture that I have included, or the diagram that I have included on this slide, it does show the transmission cycle and how the West Nile virus can be constantly transmitted between the mosquitoes and the birds. And in nature, the West Nile virus cycles between the mosquitoes and birds. It is a constant transmission between the two of them. Some infected birds can develop high levels of the virus in their bloodstream, and mosquitoes can become infected by biting these infected birds. After about a week, infected mosquitoes can pass the virus to more birds when they bite. Mosquitoes with the West Nile virus also bite and infect people, horses, and other mammals. However, humans, horses, and other mammals are what are called dead-end hosts. This means that they do not develop high levels of the virus in their bloodstreams and cannot pass the virus on to other biting mosquitoes.
Hi, I'm Carly Makoviak, and I have the treatment and prevention of the West Nile virus, and we basically treat the symptoms, which are fever, headache, joint pain, muscle aches, and to treat that we do painkillers and fluids. And there are rare some who do not keep hydrated, so they have to be hospitalized to be hydrated with an IV. And with prevention, we would use a bug spray. We wear long pants, tall socks, long sleeve shirts, and to mosquito-proof our home, we would get rid of empty standing water such as flower beds, pool covers, gutters, bird baths, and we install screens in our windows and doors. You may not know this, but mosquitoes and dead birds are where the West Nile virus is kind of made around. Bye.
How can West Nile virus be prevented? Because every mosquito bite increases your chance of infection, take steps to prevent West Nile virus each time you are outdoors. This includes keeping your skin covered as much as possible by wearing long-sleeve shirts, pants, and socks. Wearing an insect repellent can also help. Repellents containing DEET, picaridin, IR3535, and some oil of lemon eucalyptus and paramethane diol products provide longer-lasting protection. To optimize safety and effectiveness, repellents should be used according to the label instructions. Mosquitoes are attracted to standing water. By eliminating any standing water around your home, you can reduce your bite risk. Your home's windows and doors should also have screens to keep mosquitoes from entering your home. Mosquito bites are most common in late August, early September, according to the National Institutes of Health. As the weather cools, your risk is reduced because mosquitoes do not survive in very cold temperature. Remember the 4 Ds to defend yourself against West Nile virus. Dusk to dawn are the times of day you should stay indoors. Dress in long sleeves and long pants. DEET is an ingredient to look for in your insect repellent. Drain standing water in your backyard and neighborhood. How can we help control the spread of West Nile virus? Support your local community mosquito control programs. Mosquito control activities are most often handled at the local level, such as through county or city government. The type of mosquito control methods used by a program depends on the time of year, the type of mosquitoes to be controlled, and the habitat structure. Methods can include elimination of mosquito larval habitats, application of insecticides to kill mosquito larvae, or spraying insecticides from trucks or aircraft to kill adult mosquitoes. Your local mosquito control program can provide information about the type of products being used in your area. Check with your local health department for more information. Contact information may be found in the blue government pages of the phone book. Please report any dead birds to local authorities. Dead birds may be a sign that West Nile virus is circulating between birds and the mosquitoes in an area. By reporting dead birds to state and local health departments, you can play an important role in monitoring West Nile virus. State and local agencies have different policies for collecting and testing birds, so check with your state health department to find information about reporting dead birds in your area. What are the current treatments or vaccines available for West Nile virus? No vaccine or specific antiviral treatments for West Nile virus infection are currently available. Over-the-counter pain relievers can be used to reduce fever and relieve some symptoms. In severe cases, patients often need to be hospitalized to receive supportive treatment, such as intravenous fluids, pain medications, and nursing care. Various drugs have been evaluated or empirically used for West Nile virus disease. However, none have shown specific benefit to date. The National Institutes of Health maintains a registry of federally and privately supported clinical trials conducted in the United States and around the world.
I'm Liz Kilpack, and I'm Ashley's aunt, and I was diagnosed with West Nile in 2006, and it was miserable, but I'm back and normal and functioning like a normal lady should. So I'm just going to tell you a little bit about my West Nile and my experience and what it was like and how horrible it was. And I was one of the very first in Eastern Idaho to contract West Nile. It was the summer of 2006, and it was August. And I just had a new baby, so I had a 6-week-old baby, and we had her baby blessing, and I looked on my arms. I had someone point out that I had this weird rash all over the underside of my arm right here, and it was also on the insides of my leg. And I just thought it wasn't a big deal. It was just a rash and was not a problem. And about 3 or 4 days later, I started getting a really bad headache, and my eyes became really sensitive to light. And I didn't feel very well, and the kids were playing, and my husband was outside working. It was on a Saturday, and I just felt rotten, and I went to bed, and I told them, I said, I think I need to go to the doctor. I feel really bad. So we went to the clinic, and they gave me a shot of Toradol and said, this should help your headache. Go home. And I kind of joked with the guy. I said, do you think it could be West Nile? Because I had heard that it was coming. And he said, no, it wouldn't be West Nile. I'm sure it's not. And so I came home, and the Toradol didn't help at all. And I still felt crummy, and my eyes hurt, and I had a bad headache, and my body ached, and felt kind of flu-y, but with a really bad headache. And the next day I told Todd, we have to go to the ER. I don't think I'm going to survive this. It's really bad. And so we went to the emergency room, and I couldn't walk into the emergency room. He walked in and said, hey, my wife is sick. What can we do for her? And they said, well, it's an hour wait in the ER. And so if you would like to wait that long, you're willing to. Or we could triage her. We'll have her come in and look at all of her symptoms and see what it is. And then depending on her symptoms, we can put her in a lineup of priority of how bad it is. And so he helped me get into the hospital, and they took my temperature. It was 106 degrees, and my blood pressure was 60/40, and I had a room in about 2 minutes. And we had our baby with us and our 2-year-old with us because we didn't know who to leave him with and didn't know really how bad it was going to be. And the lady doctor came in, and she said to my husband, your wife is very, very sick. She will probably die. You need to find someone for your kids to go to. We don't know what it is, but we're going to do a spinal tap, and your children can't be here. So call someone to come and get them, and be prepared for the very worst. And I was nursing my baby on the table, and I couldn't really comprehend what was going on, but I knew that it wasn't a good situation. And they admitted me to the 4th floor because my heart had started doing funky things. And so I was on the cardiac floor, and my temperature wouldn't go down, and they didn't really know what it was, so they were just throwing the kitchen sink at me, all kinds of medications, and really treating it symptomatically because they weren't sure what it was. And then at that time, they had to send out your blood work for testing to Seattle. They didn't have a way to test it here. in Idaho, and so they sent out all the blood work, but they knew it would be a few days before it got back to me. So they just treated me for all kinds of things. It wasn't, they ruled out spinal meningitis, they did CAT scan after CAT scan, they did EKGs, they did a terrible intravenous ultrasound kind of thing, and it was not a fun experience. And so they treated me symptomatically, but I had a lot of problems that were happening. My heart rate dropped severely, and it continued to drop and continued to drop. And pretty soon my heart rate was around 35 beats a minute, and they knew they needed to do something. So they injected me with atropine, which increases your heart rate. And my heart rate went from about 38 beats a minute to 80. And I thought my heart was gonna come out of my chest. But they continued to just give me things that treated symptoms. So headache, fever, nausea, blood clots. And I was really, really sick. And I remember telling my husband one night, I just don't think I'm going to make it. I really don't think I'm going to make it. And there's this really nice lady down the road whose husband died of cancer. She would make a very good mother, and she would be a really good wife. And it's okay if you marry her after I'm gone. And he looked at me and he said, "You are not gonna die." And he went and got a nurse and said, "Things are not getting better. What do we need to do?" And so after 4 days on the cardiac unit, they moved me to the ICU because my blood pressure was very low, my heart rate was very low, and they still didn't know what the problem was. I was there about a week, and I felt like nothing was getting done that I needed to have done, and they weren't coming up with any answers. And I was in the ICU, and I said to the doctor, "What do I need to do to get out of here? I don't think I can stay here any longer. I'd rather be home and miserable than here and miserable. I have, 4 little kids and a brand new baby. I need to get out of here." And he said, "Well, you can't leave until you can walk down the hallway by yourself in the ICU." And so I said, "Great, get me up. I'm gonna do it." And I had a lot of balance issues and a lot of nausea, but I got up and I walked down the hallway, and I threw up at the end of the hallway, and I walked back to my bedroom, and I got in bed, and I said, "You need to release me. I can't be here any longer. I need to go home, and I don't know what it is, but it feels as if what you're doing is not helping me." And they didn't know it was West Nile yet. It wasn't until about 10 days later that they had the test results, and they called me and said, "You have West Nile." And I started going to an internist, and I can't remember the name of the doctor. Anyway, Dr. Bowie Trago in Idaho Falls works on all kinds of endocrine and internal issues, and I went to them for a long time. They did blood work for a really long time. My heart rate is constantly low. It took me about 6 months to be able to walk without vomiting. And West Nile is an interesting, virus. It attaches to different parts of your body. So while some people may have problems with their brain, others have problems with paralysis and their spine, mine was really close to my heart. And so that's where the West Nile kind of affected me the most, was with my heart. And I wore a heart monitor for a long time because my heart did really weird things and is very, very low. And really the only side effect that I have now of West Nile is very low heart rate, which isn't a bad thing. The cardiologist said, you get every human gets so many beats in their lifetime, and because yours isn't very fast, you just will live longer. And I haven't had any reoccurring symptoms. Occasionally, if I get a headache, it may seem a little bit different than a normal headache does, just because of the light and the sensitive issues with that. But other than that, I feel very healthy. I'm running again and exercising. I've had more children, and I hate mosquitoes. I'm grateful for county abatement plans that help eliminate mosquitoes, because that's how I got it. I must have gotten it in my yard at the farm. We live in a rural area where there's a lot of standing water for animals and canals and ditches, and I'm sure that there were infected mosquitoes. And I just assumed that that's how I got it. I'm grateful for medical fields and doctors and people who are willing to examine that. and processes that put in place because people get sick. So now West Nile testing happens here in Idaho. It doesn't take that long to find out what your sickness is or what virus is affecting you. And there's been a lot of advancements on how to help treat it and an understanding of how it can affect you or not. I know people that died from it. I know people who are still suffering from several forms of paralysis from it and lots of medical issues. And I just count myself as one of the lucky ones who, for some reason, was able to conquer West Nile, and I don't have a lot of anything left over from that. So it's nasty. Put on some DEET and cover yourself in mosquito repellent and cross your fingers that West Nile doesn't come to you.